Breastfeeding is often seen as a natural and beautiful experience, but to so many mothers, it comes with a host of unexpected challenges. These challenges can make mothers feel overwhelmed, frustrated, and even guilty when breastfeeding did not go as planned. Good day, everyone, and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you 10 challenges involved in breastfeeding. 10 challenges mothers are likely going to face when breastfeeding their baby. I'm not just going to be sharing the challenges, I'm going to be providing solution for each challenges most mothers face when it comes to breastfeeding. But before I go into the details proper, I just want to let you know that you and your baby are learning the ropes at the very beginning. So you don't have to be hard on yourself because you are learning, and also your baby is learning how to get breast milk from you. So let's dive straight into the point. So the first challenge most mothers face when it comes to breastfeeding is actually latching pain. Yes, I want to let you know that it's 100% normal for you to feel sore when breastfeeding is just starting, when the baby just puts the mouth on the nipple. It's normal to feel a little bit of soreness during that period. But if that soreness lingers for seconds, there could be a problem with the way your baby is latching, with the way your baby is breastfeeding. So it's normal at the very beginning, especially for first-time mom, when the baby grabs the nipple to feed. But if during the feeding section, the pain continues for a very long time, then your baby might be having issue latching properly. Now, what could be the solution? The solution is to make sure that your baby latch properly. The question is, how do I make sure my baby latch properly to avoid latching pain? So I have something that looks like a breast here. So you can see, let's assume for mothers, you assume that for every breast there is a nipple. Yeah. So just make sure that your baby is not putting this gum, the mouth, on the nipple. You want to make sure that your baby open his or her mouth as wide as possible. So what my midwife usually advise when they come to visit me is that when your baby wants to latch, put the nipple at the nose. That's the nose. Let them smell it. Then when they smell it, you see them taking their mouth, like they want to open their mouth wide. They take their mouth up in such a way that the jaw is more opened and it grabs. You see them like the jaw covers this place, not just the nipple. So, but when the baby is like putting pressure on the nipple, it's going to cause that latch pain. But if the baby is able to open the mouth properly, definitely it's going to reduce that pain or stop that pain. It's not going to cause that latching pain. So if your baby is not properly positioned when breastfeeding, it can cause that latch pain. So you can watch more videos on how to latch properly. This is just like a little experiment on how to go about it. The second challenge most breastfeeding mothers face is actually cracked nipples. Cracked nipples might be as a result of different reasons, such as improper latching. Your baby is not latching properly. It can also be as a result of improper pumping. You are not pumping that breast with a breast pump properly. Then the other one might be as a result of thrush, and it can also be as a result of dried skin. So cracked nipple can be caused by these things I just listed. Now, what is the solution for cracked nipple? So what you need to do is that if your baby is not latching properly, ensure your baby latches properly. I've explained that in point 1. Then the second one is when it comes to pumping, be it manual or electrical pumping, make sure you get the right nipple size. The pump I used now, the pump I currently use, it came with different sizes. So all I just need to do is to get the appropriate size that actually suits mine and use it. With that, there is less pain and there is no crack when you pump. Like as I also said, it can also be as a result of dried skin. So what I advise is that if you notice dry skin or you have dried skin generally, or you're even experiencing this mild pain, I would advise you get some nipple cream. There are nipple cream that you can use to massage around the breast to actually moisturize that area and prevent cracked nipple. So I also advise that because personally I use the nipple cream and it's actually helped me a lot. Just that whenever I want to breastfeed, I am usually scared. I don't breastfeed with the nipple cream. I usually wash it away and allow my baby breastfeed. Then what I also advise is that cracked nipples might lead to the introduction of infection into the breast. So what is other advice is for you to wash your nipple at least twice a day to reduce the spread of infection so it doesn't result in mastitis. And if you are having mild pain with a cracked nipple, I will advise you take mild pain killers such as acetaminophen, which is popularly called paracetamol. So that is a second challenge. The third challenge is usually engorgement. Yes, breast engorgement. I personally experienced this immediately after giving birth. So when the breast is engorged, it is hard. Like when it's very, very hard, it is like stiff. And most times the babies do not usually lactate very well with an engorged breast. Now, what is the solution? So what I advise is that if you're having an engorged breast, especially immediately after giving birth, it's either you try to hand express. You hand express the breast milk. When you hand express, don't waste it. I don't advise wasting that, especially for the first week, because that is colostrum. So it's better for you to keep it. Okay, so it's either you hand express or massage the breast before your baby breastfeed. And if it's too much, I would advise you also use a breast pump. Yes, if it's too much, I would advise you use a breast pump because breast engorgement is not good. It can actually lead to the blockage of the ducts where the milk is coming out, and the baby will not be able to get milk on the long run. So you either hand express. If you have the breast pump, you also express with a breast pump and also use some warm compress around the breast. That actually helps to reduce the pressure around it when it comes to breast engorgement. The fourth one I would like to share with you is clogged duct. What do I mean by that? You know that for milk to come out, it's coming out through a duct. Like it's going out through a duct. So when the duct is clogged, that means it is blocked. The milk cannot come out. And this can be caused when the breast is full or you've gone between feeds, you didn't breastfeed frequently. So the breast milk did not go away. So it's stayed back and it clogged the duct. So when the duct is clogged, the breast milk cannot go and the baby cannot have it. How do you know your breast is clogged? You usually feel this hardness. It's like breast engorgement. There's hard breast and also there might be redness around the nipple noticed. So even if the baby suck, the milk doesn't really go out of the breast. It can also be caused by compressed breast. You're compressing your breast. It can also be caused by improper pumping. You're not pumping properly. It can also be caused by the wrong size of bra or something hits the breast at the particular spot. That can actually cause the breast duct to actually clog, and when it's clogged, breast milk cannot flow. So what is advisable? Remember we said that it can be caused by you not feeding frequently and your breast is overly full. So we advise you continuously feed your baby in that affected breast until it is emptied. All right, then also pump out some if possible. Remember, if you have any challenges when it comes to breastfeeding, I personally will advise you to speak with your midwife. Speak with your midwife because they are in a better position to provide appropriate help for you. Then the fifth point I would like to share with you is mastitis. Mastitis is an infection of the breast. Yeah, it's an infection of the breast caused by bacteria. And this can be as a result of cracked nipple, breast engorgement, or clogged ducts. These three things can actually cause mastitis. When it comes to the treatment of mastitis, your doctors are likely going to prescribe antibiotics for you to take to actually kill the bacteria causing that infection. Mastitis usually come with pain and also fever. So get it treated, get it reported to your GP, and get it treated with an antibiotics. The sixth challenge is actually thrush. And thrush is transferred from your baby's mouth to your breast. Yes, thrush is transferred from your baby's mouth to your breast. And what you are going to notice is a shining red-like thing around your nipple. Yeah. So, and also you might notice this throbbing pain in the breast. You might experience pain in the breast. So if you notice it, it's advisable for you to speak with your GP. They are going to prescribe some antifungal cream for you, which you are going to use to rub the nipples area. And also what is advisable, because thrush you can spread it from your breast to your baby's mouth, from your baby's mouth to yourself. It's advisable for you to also change your breast pads regularly, to change your bras regularly, and also to change your clothes that you use for breastfeeding regularly to avoid a transfer. Just practice good personal hygiene, not just for yourself, for also your baby. It's going to go a long way to prevent thrush coming over and over again. And also, if you have cracked nipple, breast engorgement, try and get it sorted out as soon as possible. And the seventh challenge is actually low milk supply. For mothers, they are worried, oh, my baby's not getting enough breast milk, I'm not producing enough breast milk. I made a full video explaining tips that are going to help you boost your milk supply. But one thing I want you to know is that when it comes to breastfeeding, the more your baby latch on your breast, the more milk you are definitely going to produce. So if your baby is unable to latch properly, if your baby is not being put to breast regularly, getting breast milk is going to be difficult. So what I encourage you to do when it comes to low breast milk supply, put your baby to breast as often as they want. Put your babies to breast as much as they want, because that is going to increase the supply. So in terms of breastfeeding, an increase in demand increases supply. An increase in demand increases supply. Then the eighth challenge is breastfeeding mothers face. Some breastfeeding mother face is actually inverted nipples or flat nipple. You may be wondering, how do I know I have inverted nipple? So take your thumb fingers, your thumb and this index finger, put it at the areola. The areola is the place around the nipple. Put it at the areola. So once you, let's say you put some pressure on it like this, if you put some pressure on it, if it retracts, it goes inside, then you have inverted nipple. But if it protrudes, it comes out, then your nipple is okay. But if it goes inside, then you have inverted nipple. If you have inverted nipple, I just want to let you know that you should not be worried. What it simply means is that you need experts to help you out. Like you need your midwife to guide you on how to go about it with inverted nipple. After getting a pro to help with inverted nipple and breastfeeding, it's also advisable you try some breast pump. Try using the breast pump, try using your hands to bring it out and see the outcome. But in situation like this, I would advise you speak with your midwife, you confide with your midwife and talk to them in regards to breastfeeding, especially when you want to breastfeed your baby. Then the ninth point is the painful letdown. This pain is usually tingy, it's usually pricky, it's like a needle pain. You just feel it. And for some people, they feel it deep down within the breast, like the breast tissues, not just on the surface. So that painful letdown is also some of the challenges some breastfeeding mothers face. So in such a situation, I would advise you always feed from the breast that is fuller before going to the one that is not full. But if the pain is really worse, it's advisable you speak with your midwife. Then the last point which I want to share with you, which is the number 10 challenge, is the sleepless night. The sleepless night most breastfeeding mothers experience is what is not properly talked about. Like when a newborn enters your house, you know you have to be feeding this newborn every 3 hours, every 2 hours. Some newborn will not even feed every 3 hours. Every 2 hours they are awake and you have to be awake. So that sleepless night is one of the major challenge, like 99.9% I will say that most breastfeeding mothers face. Yes, they actually face that sleepless night, tiredness and everything. When it comes to the solutions for this sleepless night, what I would advise is that get some rest. Try as much as possible to relax. While you're having a sleepless night during the night, if you can express the breast milk and keep for your partner, it's very important for you to do that, so they can also feed the baby during the day while you are at sleep. Or preferably, for some night, you express and keep for your partner or your mom or your helper to feed the baby during the night while you sleep. You have to just make sure you get enough sleep, because stress, anxiety, lack of sleep can also affect breast milk production. Just try to look for a way to make sure you get enough sleep. For me, what works for me is that I stay all night breastfeeding the baby. I express the breast milk, keep during the day for my partner, then I'm able to sleep. He takes over at about 7, 8 a.m. with the baby, and I have already expressed milk in the fridge. So that goes a long way to help me get enough sleep. Because when you don't get enough sleep, when you are anxious, it decreases the level of cortisol, and this actually affects your milk supply. So please and please, as a breastfeeding mother, try to get enough rest and also try to get enough sleep. So this is all I have to share with you today in regards to the 10 challenges breastfeeding mothers face and also the solutions I have provided. And I hope this video is beneficial. So if you have any breastfeeding mother, kindly copy the link of this video and send to them. Or if you have a soon-to-be mother, kindly copy the link of this video and send to them. Thank you very much for staying tuned. Thank you very much for watching. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.